Meeting. I'm Lucy Lawrence, the board chair, and I am happy to call this meeting to order. Our first action item on the agenda is to approve our agenda for today's meeting. And this agenda was sent in your board packet last week, and I will entertain a motion to approve and a second from one of the other board members.
I second.
Mrs. Lando, I move that we approve the agenda as presented.
I heard a second before I got Linda's motion. Is there, who was the second?
Betsy said it. I said
Thank
it.
you, Betsy. All those in favor?
Aye.
Any opposed or abstentions? All right, great. We are moving along with the agenda. In accordance with the State Government Ethics Act, it is the duty of every board member to avoid both conflicts of interest and appearance of conflict. Our third agenda item is to review and vote on our July board meeting minutes that were also included in your packet. And I will entertain a motion and a second.
I move to accept the minutes.
Thank you, Dick. Is there a second? Thank you,
Mrs. Lando,
David.
I second.
Oh, I
go
saw
ahead.
David, sorry.
No problem.
All those in favor?
Aye.
Any opposed or abstentions? All right, thank you. Our July board minutes pass, and we move on to new business, and I'm turning things over to Colleen.
Hello, everybody. I can't say good morning because it's not the morning over there, it's the afternoon. So I am going to share my screen while we walk through this. While we go through this process. So hang on, let me make sure we've got everything as it should be. All right. Okay, so you will see, I have put a link in the chat. Ignore that for now. I just needed to make sure that it was there and available for the next step of what we're going to do. So what are we going to do? We are reviewing the department's business plan goals with the intention of selecting 4 priority goals for the board. As a reminder, this business plan is the department's work plan for the next 2 years that gets reported up through the county manager's office to the Board of Commissioners. In theory, it also aligns with the strategic planning process that is currently underway, and helps kind of tie the more strategic visions with day-to-day operations at the department level. So each of you in your committee meeting reviewed the specific goals from your division, the division that's represented by the committee on which you serve. I'm going to go over a very quick review of all 16 goals because not everybody has seen all of the different goals. I will spend more time on the administration level goals because none of you have heard that. So for those of you that were not in the Public Health Committee, here are the goals for the Public Health Committee. And again, as you're listening to these, I want you to think about the fact that when we're done with this conversation, you will be voting for the 4 goals that you think are critical or the most important for the board to pay attention to. And as you're thinking about the criteria to use to make that decision, my recommendation is that you think about your role as a board member primarily through the lens of advocacy, which is one of the most important things that you do, specifically advocacy that amplifies the advocacy of others. So that's one thought. And then the other one is one of your other roles and priorities as a board is helping to ensure accessible and equitable services. So think about these goals through those two lenses, as you will then have to go through a very difficult choice of picking just 4 of the 16 that you'll be hearing about. So for those of you not in the Public Health Committee meeting, the 4 goals for public health focus on, the first one is preparedness. The goal is to have 90% of public health staff trained in emergency response and preparedness by December of 2027. I'm not going to go into each of the initiatives. You can see the initiatives on the screen that give you concrete examples of what types of activities and initiatives the division will go through in order to achieve that particular goal. The next one is around equitable access. So identify communities with a high social vulnerability index and increase outreach events by 5% in those areas identified by 2027. So you can see there's a link here to the community index map, which is how we know where those communities are. The next one is infant mortality. The goal is decrease the Black versus white infant mortality disparity ratio by 10%. And we're still waiting on the baseline data, but we will have that before we finalize this plan. The fourth one is a focus on environmental health. The goal is to increase food and lodging inspections by 20% by December of 2027. So those are the public health goals. I want to pause for a second, reach out to the members of the Public Health Committee and see if you have anything of clarity or clarification that came up in your committee meeting that you think it would be important for the entire board to hear. And I would say just unmute and start talking because I can't see who's.
Hey, yeah, I'm the committee chair for the health. We talked about addressing access. We were interested in looking at NC Care 360 to see the data about referrals, both going out and then being accepted. And we also wanted to look at the mobile team.
Okay. Very good. I'm going to move, thank you, and congratulations, Madam Chair. I'm going to move on to the social work business plan goals. So their 4 goals are, the first one focuses on the safe and resilient workforce. The goal is to increase the retention of social work staff by 25% by December of 2027. The next goal centers on racial and language equity. And so the specific goal is to decrease the percentage of BIPOC children entering the foster care system through CPS investigations by 15%. Again, like with another goal, we're still waiting on what the current baseline data is, but we think that we will have it before we need to finalize the business plan. The third goal is centered on quality evidence-based service array. And the specific goal is to reduce the number of nights per year children are sleeping at the Grace Center or the DSS office by 20 nights each year. And then the fourth and final one focuses on sustainability of a trauma responsive culture. And the specific goal is to increase the implementation of trauma responsive practices within the social work division by 25% every 6 months through December of 27. So I'm going to pause here and see if anybody from the I guess we call it the safety committee, wants to weigh in on any of these particular goals and share anything from the committee discussion. All right, then I'm going to move us on. So the next one, and this one I'm going to spend a little bit more time on because none of you have seen these. This is from the administration chapter of the business plan. And the first one is focused on contracts. And so I should say the administration chapter of the business plan is very much focused on goals that are cross-cutting across all of the divisions and helping the divisions work more efficiently, more effectively together as a department. So the first one is around contracts. Ensure that 75% of service contracts have at least 3 measurable outcomes. And again, the deadline is by December of 2027. So specifically here, what we're noticing as we go through the contracts signing process is that there is a lack of consistency in the contracts across the department. Some of them have pages and pages of outcomes. Some of them have 0 outcomes. And so we want to make sure that there are at least 3 measurable outcomes for every contract where we are giving funding to another organization in order to help us do the important work that we're doing. We want to make sure that at the end of that contract period, we can look back at that contract and see what exactly was accomplished. The next one is we do have to have at least 1 employee engagement goal for every department. And so we went through a very staff-involved process in order to come up with this particular goal. I will note that just this morning we were told we have to break this into 2 different goals, and we will, but the concept remains the same. So essentially increasing the favorable response for employee engagement in the prioritized areas of communication, trust in senior leadership, and cross-team collaboration by 5% by December of 2026. And again, as a reminder, we talked about this, I think at the last meeting, there was an employee engagement survey done by Qualtrics, and communication, trust in senior leadership, and cross-team collaboration were the areas that were prioritized by the senior leadership team back in June as areas where they wanted to focus. We took that information to the staff and asked them to select potential initiatives to address those areas. And what you see below are the initiatives. So creating an employee engagement team, creating a bi-directional shadowing team. And what we mean by that is not just leadership shadowing staff, but staff shadowing leadership. Create a communications continuum that addresses everything from what happens at the senior leadership team meetings, where we'll send out those minutes, to a weekly email from the director, to a wide array of other ways that staff can communicate with leadership and leadership can communicate with staff. And then for specific focus on collaboration, looking at a day in the life and other team events where the divisions can work collaboratively in learning about what's going on in the community. The third goal for the administration chapter of the plan is to review 80% of the client-facing job tasks across the department for downtime. And downtime is an acronym that I cannot tell you what it stands for. So if y'all want to know what it is, Kelly will tell you. But basically, going through a process that looks at how do we do the work that we do that focuses on the clients, and how can we make that better? So that's the third goal for administration. The last goal for administration focuses explicitly on collaboration. The goal is to develop an HHS collaboration priorities matrix where we will go through as a department, identify perhaps 10 collaboration priorities. We will pre-populate that matrix with partners that we are aware of, that we either know work in this area or we are working with in this area. And that will allow us to see who we're working with on what, and will also allow us to see other opportunities to expand and improve our collaboration across the department. So with that, I'm going to stop and see if you have any questions about these administration chapter business plan goals. All right, I'm just going to keep us moving then, y'all. Economic services business plan goals. So the first goal for them focuses on this no wrong door concept. The specific goal is collaborate with other departments and community partners to increase opportunities for no wrong door events, where economic services staff are available to complete applications for public assistance programs. So again, improving access to services. The next one is Medicaid processing time. The goal is to reduce the average application processing time to 35 days for Medicaid applications, which right now the state requirement is they have to be processed within 45 days. And then for 75 days for the applications that have the state requirement of 90 days. So trying to do better than the minimum for both of those categories. The third one is abandoned calls, which some of us would call dropped calls or hangups, but increase the number of days that the abandoned call goal is met to 75%. So I can't remember. Hopefully Philip covered what the goal is. Was it like 3 minutes or 4 minutes? Anybody on that committee might need to help me out here. I can't remember what that was.
I believe he compared a percentage of dropped calls now versus calls as a goal.
Okay.
He said now we're at about 21 or 22%, and I might need some help from the committee because I could have sworn he said he wanted to get it down to 3%, which sounds to be pretty low, but he wanted to get it lower than it was.
Yeah, 3% sounds right to me too. So
to 7%.
to 7%.
Yeah.
Okay.
That's
Well,
right, 7%. 7%.
We'll get maybe I'm thinking 3 minutes. I don't know. It's funny. It's more complicated than you would think. And Philip had to jump off and go to another community event, so he's not here to help us.
Colleen, I'd like to ask a question. How do they intend to manage those drop calls? Is this something that they do through caller ID and return the phone call, or just how do they do that?
So the idea here is that somebody calls into the call center and waits too long, in their opinion, and hangs up.
Okay.
And so we want to make sure that we are operating as efficiently as possible and getting to all of the callers as quickly as possible so that they don't feel like they've been waiting too long and hang up. And so that's the idea behind this. The last one is around the STEP program participation, and STEP is a workforce development program. So increase the number of food and nutrition services participants who are also participating in the STEP program by 10%. So again, the baseline data is under development and will be included in this goal. So questions or comments from the Economic Services Committee about the business plan goals? right, I'm going to stop sharing my screen then. And Paul is going to help us. All right, I'm going to hit enter so that you can see this link. So we are going to go through a process where you will be voting either from your phone or from your computer. If you prefer to vote from your computer, I just put a link in the chat that you can click on to access the document. If you prefer to vote from your phone, you can put your phone next to the screen on your computer, next to the QR code, and the link will pop up automatically on your phone, and you can vote from your phone. So what you will see is all of the 16 goals that we reviewed very quickly. And you will go through and vote for the 4 that you think should be the priority for the department. As you are voting, we will see that information populate on the screen. And once we have all of your votes received, we will be able to see what the top 4 priorities will be for the board. And then we can talk about what that looks like. So please go ahead and either access the survey via your phone or access the survey via the link I put into the chat and begin your voting. And Paul, will you show us the screen where we see what happens? Is that what the screen is here, or is that a different screen?
It's not working for me on the computer.
I
It says I
just
don't have
tried.
permission to view or respond to this form.
Hold on
I
one second.
didn't
I'll fix
have
it.
access on either.
Okay,
One second. One
Thank you
second.
all.
the permissions. Give us a second. There.
You should try it now.
That worked. Thank you.
Yep.
And do you need to drop another link
It'll be
in?
the same. It'll be the same link. You may
Okay.
have to leave. You may have to leave the survey you were just in and go back into it.
Got it. Thank you. That works really well. I appreciate y'all.
One nice thing about the pandemic is that we all got so much better at virtual feedback and input.
Well, it's not working for me.
So did you exit out and re-enter it?
So what do you want me to exit out of? Here?
No, don't leave the Zoom meeting, but if you, did you try to access it from your computer or from your phone?
I'm gonna try my phone again.
Okay, all right.
Okay. I did it. I did do it. Okay. I'm better the second time.
Everybody is. Linda, I see you've unmuted. Is it working for you?
Yes. I was just going to say that it worked better from my phone and the QR code.
Okay.
I think I'm gonna have to find another way to access this because it's not working for me under Microsoft.
Mm.
And if I had a Microsoft account, I'm not sure if, I don't think I remember the passwords.
What worked for me was yeah, the link over in the chat column on the side. Maybe y'all know that.
Let me
Took
see if I
took me a
okay.
bit to figure
Let me
that.
see if I can access that.
Yeah, that should bypass all the account requirements.
Okay. Now, let's go back for a minute, Colleen. So you're wanting us to select 4 of these goals. Am I on the right page?
You are exactly right.
Okay.
What 4 of the 16 do you think are the most important for the board? So it looks like we have 11 responses submitted so far. Krista, how many board members do we have on the call?
That's 100%, Colleen.
11 is everybody?
Okay.
No, there's actually 12.
Oh, they're 12, missing one.
All right, and now we have 12. So Paul, can you work your magic so that we can see what the top 4 are?
So it looks like the top 2 are goal 2, goal 3, goal 5, and goal 13.
Okay,
I can read those out to you as well.
that would be great. Thank you.
Yeah. Goal 2 is equitable access, identify communities with high social vulnerabilities. Goal 3 is infant mortality, decrease Black-white infant mortality disparity ratio by 10%. Goal 5 is safe and resilient workforce, increase retention of social work staff by 25%. And goal 13 is no wrong door, collaborate with other departments and community partners to increase opportunities for no wrong door events.
Excellent. All right. Anybody have comments or thoughts about those 4 goals? So it's 2, 3,
5 and 13.
5, and 13. Okay.
Yep.
All right. I'm glad it worked for everybody. All right, so let's close out this screen and then let me share the description of the business plan goals again, just so you can see specifically what we're talking about. So equitable access. So some of the initiatives there are collaborating internally and externally for services, capturing demographic information, expanding mobile services, improving access to services specific for wastewater treatment and well systems, and then using the community index map. So this would be something that we could report out to you on a quarterly basis with an update on here's what we've done around these initiatives. Here's how this work is going. Could even look at what that community index map looks like in a little bit more detail and show you where we will be focusing. Does that sound good to everybody? Okay, I can see Lucy nodding her head. Speak up if you think that's not a good plan. All right. The next one is infant mortality, decreasing the disparity between the Black infant mortality rate and the white infant mortality rate. And I know that your group talked about this NC Care 360. So perhaps we can start the conversation with an in-depth review of what the NC Care 360 does and how it works and how it can help address the disparity. Does that work for folks? All right, speak up if it's not going to. And then number 5 is the safe and resilient workforce, increase the retention of social work staff by 25%. This is something I participated in that committee meeting. This is something we spoke a lot about. And so I know that that has been a priority for that committee for a while and will continue to be a priority, I think, for the board.
I'm really proud of us for making that a priority because I think if we can strengthen and support the workforce, the work itself will follow and improve, and services are going to be much better. And quality of life for our workers will be much better.
Yeah. All right, and then number 13, collaboration. So oh wait, that's not it. No wrong door. Collaborate with other departments and community partners to increase opportunities for no wrong door events. So that is something where we can make sure to keep you in the loop on what that looks like, but also utilize your skills as ambassadors and community leaders to help us know of opportunities where we can go and provide an additional door for people to access services. So it seems clear to me that there are opportunities for you at the board level to be involved in all of these 4 priorities, which is great. I have what I need to move forward with the next steps, which will be to share with you in writing what those look like and what some board-specific reporting timelines look like for each of them. And so we will share that with you at the next board meeting. Anybody have comments or questions or concerns about the process, the selections, anything? Go ahead, Dick.
I regret that none of the 4 goals of administration was chosen. I think that administration is important, and I voted for process improvement because I thought that would help everywhere. Because we only had 4 to vote on, so I figured
I
vote for one would be really a quadruple vote.
Well, and there's still going to be department, all of those 16 goals will be goals for the department. So the work will happen. It's just how much information will be shared with the board about the work. And I think you could certainly request that specific information be shared with you. I mean, we'll be sharing information about the business plan and accomplishments, but probably not as frequently as the 4 priorities. other comments or questions or concerns? All right, Madam Chair, I'm going to turn it, well, I guess I'm going to turn it back to you to turn it back to me to do the director's report.
Well, why don't you just take care of that now?
All right. All right, so my director's report is relatively short. I did want to highlight the fact that the Economic Services team did win a North Carolina Association of County Commissioners statewide innovation award. I know, it's super exciting, and they were recognized by the Board of Commissioners last week. The project that they were recognized for was a statewide training platform. So they developed a training platform for Buncombe County staff and realized that they could open it up to the entire state and really improve all of the economic services programs throughout the state. And as of the time of the award, over 70 other counties had accessed this training platform and utilized it as a way to train their staff in economic services. So very much something to be proud of, and did want to give a shout out to economic services team for that award. The other thing that I wanted to mention was that we have been very busy talking to the Board of Commissioners. We've had a number of presentations and reports and proclamations, including a presentation about avian flu, a presentation about a recovery housing grant that we received for $1 million, a breastfeeding resolution, recognizing the importance of breastfeeding. And then in September, we will have presentations on behavioral health and how it has now come up under public health and how that will work, as well as our very own Lucy will be giving our annual report about the board to the commissioners in September as well. So wanted to share those two things with you. Other than that, things are very much, I'm spending a lot of time on budget related conversations, making sure that we are in good shape once the budget season kicks off after Labor Day. So that has been a focus of mine over the last couple of weeks. So I'm happy to answer any questions if anybody has any. All right, then I'm going to turn it over to our chair.
Colleen, thank you very much for being very active and proactive as an interim. I feel like we have not stopped momentum. So thank you.
Thank you.
I do want to begin my report picking up on what Colleen had said, that I am making a report to the commissioners in September about our board work. And I have been working with our exec committee on identifying the various challenges that we want to make sure that they are aware of. And we have identified HB 76, Medicaid expansion, foster care, and the energy program. I wanted to solicit your ideas if there are other challenges that have perhaps come up in your committee meeting discussions that we want to make sure reach our commissioners. Okay, if there are none, I do want to say that, Colleen, I imagine that we are going to discuss the priorities that we have identified today, and those will be in the presentation to the commissioners.
We could certainly add that slide, sure.
I think that would be
Again, I've
great.
been reminded since I reminded y'all that I was reminded 3 times that it's a
10
10-minute
minutes.
presentation, so.
Yes, I can speak quickly.
All
And then
right.
we also want to make sure that the commissioners know that we have an ad hoc committee that is working on a land and labor acknowledgement for our board. And I think that is all I was going to say about that presentation. See, I kept it brief, Colleen. I'm modeling in preparation for the commissioners meeting. Next, I'm going to hand it to Linda, who is going to provide an update about the director search.
Well, we have, apparently there were more applicants after they extended the deadline for, the applications to come in. I don't know how many came in, but there are 3 first-time interviews set up for, I think it's September the 4th, whenever that is. It's a Wednesday. And so, we're kind of on a hold pattern until we can get those interviews accomplished. And that's really all that I feel like I can report at this moment. Lucy, did I miss anything? Can you
I
think
don't
of
think
anything?
so,
Yeah.
except that there were 2 candidates that we had interviewed in our first search that we are moving forward to the second.
Okay.
Well, are we moving? They're going to be in the mix in terms of consent.
They're later, but I honestly was not sure if those 2 second interviews would actually occur or not. So, the only thing new is to say that we have 3 first-time interviews scheduled for the 4th. And, that's, as for those second interviews, the 2 holdovers from the first sessions, I'm assuming that they will be eligible for a second interview. But I don't know that for sure. And that's pretty much it at this point, y'all.
Thank you, Linda.
Oh, you're
And
welcome.
I also want to thank Dr. Lima, who is serving on that committee alongside Linda and me. And then my final piece of my report, I have a card from Stony that I would like to read to everyone. He writes, "Dear HHS Board, thank you so much for inviting me to the July meeting. Your kind words, in person, in writing, and engraved on the beautiful plaque were very encouraging. Thank you also for the generous gift to REI. I enjoy this very much. Finally, thanks for being such an engaged and supportive board over the past 6 years. Many blessings, Stony." All right, and that concludes my report. And next order of business is a motion and second to adjourn.
This is Linda. I move that we adjourn.
Thank you, Linda.
Second.
Oh, was that you, Steve? Okay, thank you. All those in favor?
Aye.
Aye.
Bye. Enjoy the beautiful day. Steve has got a jump on all of us.